You are watching a recording of a training webinar about how to conduct a systematic review. This webinar series was developed by the Impact Research Programme in partnership with Cochrane Common Mental Disorders and Cochrane Global Mental Health. This video is of Session 1, Introduction to Systematic Reviews, and the webinar was recorded on the 16th of July 2020. This is the first of a series of sessions. The session is introduced and hosted by Jen Brown.
So here's a little overview of what we're covering today. We'll start with introductions and some webinar housekeeping rules. And then we will have a chat about what systematic reviews are, what we mean when we talk about them, and talk a little bit about the pre-course work that we asked you to do. We'll talk you through the aims and objectives for this training so that you can make sure it is what you're wanting it to be and it'll be useful for you. And then we will get started on the content. With an overview of the systematic review process and then talking about the importance of systematic review protocols. Towards the end of the session, we will have a very brief introduction to Cochrane, because you can't really talk about systematic reviews without talking about Cochrane as well. So we have Rachel on the session who will be doing that. And then we will finish off by talking a little bit about homework for the next session, which is scheduled in 2 weeks' time. The schedule is really flexible, so we will go as fast or as slow as we need to make sure everybody understands the key points that we're trying to get across to you. And so it might be that some of the things that are on the list for today actually spill over into the next session if we do find that we're a little bit short of time towards the end.
Thanks, Jen. Welcome, everyone. I'm Najma Siddiqui. I'm a psychiatrist and a senior lecturer at the University of York. I lead a few programs on global health which focus on mental and physical health. And what they have in common also is that they really focus on capacity building with our partners, sort of building our own capacity for research, but also all of our partners. So this series of webinars is part of that. I'm really pleased to see so many people interested, and even more who have said they're interested but couldn't make the session this morning. So I'm hoping this is going to be something that's going to be very useful.
Hi, I'm Rachel Churchill. I'm a Professor of Evidence Synthesis at the University of York, and my background is a mental health epidemiologist. I've spent all of my life really working in evidence-based mental health in one way or another, and as part of that I lead one of the Cochrane groups in mental health in common mental disorders. So one of the reasons I suppose I'm here today is because our work in Cochrane is particularly focused on ensuring that we meet the needs of people with health decision-making questions globally. And so we've often worked very hard across Cochrane to think about how we might build capacity. And as part of that, I've been working with Najma and others on the Impact Programme for a period of time now to think about the sorts of reviews that need to be done within the scope of Impact, and to think about how we can build capacity across the network to ensure that that happens. So that's why I'm here.
Thank you. Nikki, do you want to say hello again as well?
Hello everybody, I'm Nikki and I'm here to help in a supporting role, working alongside Najma and Jen and Rachel. So nice to see you all.
Wonderful, thank you all. So let's jump straight in with a bit of content then. For your pre-course work, we asked you to have a look at a couple of pages of the CRD guidance. CRD is the Centre for Reviews and Dissemination, where Rachel is based and where I used to be working as well. And they published this guidance about 10-12 years ago now, so it is dated a little bit, and it does predate some key developments in systematic review development and methods development even. But some of the key principles that we asked you to look at obviously still apply. And we did also ask you to have a look at the interactive learning module 1 that is available on the Cochrane website. So I hope everybody got access to that. I know some people got in touch saying that they struggled with that part, but I hope we've managed to set everybody up okay in the end.
But our aims are to go through the webinar series to learn, well, or deepen, I think, our understanding of what systematic reviews are, critically, why they're important, and then also how they're actually conducted. So what we're hoping at the end, by the end of this series, you will have an understanding of the importance of systematic reviews, particularly their role in making decisions for policymakers and for clinicians in day-to-day practice, so how relevant they are to our everyday practice. You'll have a good understanding of the individual steps that you need to take in the systematic review process, and also why you do it that way. Why is it important? We want you to be able to have the skills to plan your own systematic review. As Jen said, it would be, we're going to focus on reviews of interventions, but equally this could be transferable to other types of reviews. So this kind of skills that are involved in basic literature searching, doing a meta-analysis, and then being aware of the key resources, the web-based resources that are available to support you in your planning and delivery of a systematic review. We're going to focus in the webinars on writing a protocol, and Jen's going to talk some more about that in a bit. Some of you have said you're interested in developing your own systematic review protocol alongside these webinars, and we have offered some support from the facilitators to do that, but we are going to have to be quite strategic about how many of those reviews we take on and what topics they cover because of the constrained resources that we have. So I'm not going to say much more about that at the moment, but we'll pick it up later, and we'll definitely cover it next time, that aspect of the training. Okay, so I'm going to stop there. I think it's back to Jen.
Thank you, Najma. That was a really useful overview of what we're hoping to achieve going forwards. So, to make a start on those objectives, this is the ideal systematic review process. I think I should probably change the heading. This is the perfect systematic review, the dream systematic review. It doesn't always work out that way. It hardly ever does, is probably fair to say, but this is what we're striving for. And I think it's worth keeping that arrow in mind as we work through these webinars, and also as you embark on your own systematic review journeys, because it does convey some important underlying sort of fundamental assumptions of systematic reviewing. So first of all, it's a sequential process where each stage builds on the one that came before. That also means all the boxes are the same size, so that means each stage is equally important. So you don't skimp on something and then, pay a lot more attention to something different. All of these are equal parts of making up a good, high quality, methodologically solid systematic review. Another key feature is that the arrow only points one way. There is not a lot of back and forth involved in an ideal systematic review. So the idea is, in theory, that you do each stage so well that you don't have to go back on yourself. So that it's very important because each stage informs what comes next. So in your review question and your protocol, you lay out everything that you're planning on doing. And then obviously the literature that you find in your search influences what studies you select, what data you extract, how you're going to quality assess. And the data that you get out of the studies obviously influences your synthesis. And at the very end, you look at everything that you've got and you have to write it up and you have to tell the world about what you've done. So they're all linked. And even though the process doesn't necessarily plan for back and forth, sometimes it is a little bit more iterative in reality. So, as you go, you do have to make changes to your method sometimes. If you find that your search results just are far too big to do anything, you might have to tweak your search. And it usually, it doesn't always work out quite this smoothly, but I think it is a useful, very simplified but useful visualization to keep in mind, because in the way this is what we're striving for. And it's also quite a useful framework for teaching systematic reviews, because the webinar series will follow pretty much the same process as we go through the next couple of weeks and months. And as such, we're going to start at the start. And the first thing we're going to talk about this week and next are protocols and review questions. As you can see, they're the very first box on my image here, and they are the fundamental basis that everything else is based on. So your review question and your protocol shape and determine your entire review. It influences the methods, topic, the methods, the outcomes, the interventions you're interested in, the population that you're interested in, but also things like the scope of your review in terms of your setting, for example. Are you only interested in hospital settings, or is it a community-based intervention that you're investigating? But also in terms of geographic region. You know, we are spanning the globe today, so there is a lot of interest in global mental health, but sometimes you might find that the problem that you're interested in is very limited geographically to one country or even a region within a country. So, you know, it's needless to say really that this is an important step to get right. And I think systematic review protocols are, you know, they're gaining in popularity, and people are having an increasing awareness of why we need them. But most of you will be aware that clinical trials have protocols, and there's many trial registry websites where these can be found. And that's, you know, this has been common practice for a number of years now. And systematic reviews need protocols in just the same way, because systematic reviews are also research. So for the exact same reasons as trials, systematic reviews also need protocols. So what do we mean when we talk about systematic review protocols? So in a way, I like to compare a protocol to a roadmap. It shows you where you're going. This is our output. This is what we want to get out of it at the end, the question that we want to have an answer to. But it also shows you how you're going to get there. This is how we're going to search the literature and the databases we're going to use. Here are our methods for selecting studies, for analyzing studies, and for summarizing them. And you would also speak about the team, the expertise that you have, and your timelines for completing this work. So again, it's an important thing to get right at the very beginning, because you set out your aims and your methods in advance, and you provide a clear and transparent methodology. So it really is a bit of an exercise of spelling things out. And you don't just say, oh, we're going to search the literature. You're actually going to break down your search strategy into, you know, your search terms and your databases, and you're very explicit at protocol stage. Ideally, systematic review protocols are written and registered before the start of the review. I will speak about registration a bit more later, but you will find that when you go to register a review protocol, there will be certain eligibility criteria as to where you are in your planning, whether or not you are eligible to register your protocol on that website. And like I said, even though we have a beautiful streamlined arrow, it doesn't always work that way. And if there are changes and deviations that you have to make as you're doing your review, you should record those and report them and justify them as amendments or changes to the protocol. That's usually either an appendix that is added as an online appendix to a paper, or in Cochrane reviews, there is a special section for changes to the protocol, very explicitly built in to the review template. So obviously it's okay to make changes, because this research happens in the real world, but just be transparent about it. I think that's the key message here. Okay, yeah, lots of really good keywords coming in there. Accountability, transparency. It's a blueprint for the study. I really like that, blueprint or roadmap. Yeah, you will see that really I'm not really going to tell you that much new now. So, because my first slide about why we need protocols covers a lot of what you just said. They can reduce bias. One very, very important point. So bias is a concept that comes back in systematic reviewing quite a lot, not just at this point, but also as we assess the primary studies that we're including. But basically, bias is when our knowledge and beliefs influence what we do. And this can either be very explicit and very obvious, and sometimes it happens without us even knowing that it happens. So, you know, a very explicit case of bias would be only including your own studies in your review, or only including studies that show a certain result. But sometimes those biases are a little bit harder to unpick. And by writing a protocol and getting feedback on it, you can try, you know, producing it with a team, getting some peer review, getting feedback from other people, you get a great chance of reducing those biases that maybe you're not even aware of. So one of the ways that we reduce bias by using systematic review protocols is by pre-specifying our aims and methods in advance to increase transparency, one of those words that you guys brought up on the chat there. We want to describe appropriate search strategies to be comprehensive. So we want to find all of the available evidence, which is one of the points that you guys raised on the first question about what systematic reviews actually are. We want to review all the available evidence, and we want to aim to include all relevant studies to avoid selection bias. So not just the ones that have been published by our friends, and not just the ones that have positive results in the way that we would view positive. So we want to include all relevant studies by pre-specifying our selection criteria, for example. And similarly, we want to assess relevant outcomes, because of, you know, this is where it's important to work with a wide range of expertise in your team to unpick what the relevant outcomes are. What do we need to answer here? Because otherwise we're just sort of, you know, and if we only repeat what the trials report, then we're just in this cycle of maybe research not actually producing meaningful outcomes at all. So this is where this use of systematic reviews in policy and decision making, you know, plays a big role. If systematic reviews don't report relevant outcomes, then what use are they? The next couple of reasons why we need protocols, you guys also covered. So they help you stay on track when things get confusing during the review, and they often do. Then it helps to go back to the protocol and just remind yourselves and your team of what you said you would do, and then stick with that as far as you can. So often when you get to data extraction stage, you get so drawn into the data and into the studies that you kind of lose sight a little bit of the bigger picture, and it can be really helpful to step back and look at the protocol. Or, you know, sometimes these things take a while. You know, it takes a while to get up and running, to get the search done, and, you know, by the time you actually begin to do the proper work, you might have forgotten that some of the details that you specified. So again, it's a really, really useful thing to have your blueprint and your roadmap to come back to. And now this point about registration. And so registration means that you're making your protocol publicly available. A little bit like a trial registry website. There are protocol registry websites for systematic reviews, and it'll come up on one of the next slides what they are and how they work. But by making your research publicly available, or sharing your research ideas, your protocols publicly, you can reduce duplication, which obviously means, you know, and nobody has unlimited money to conduct research, so wasting research effort is a real problem, because there is finite funding, and we only want to do research that's novel and that addresses those gaps in the literature that we've already spoken about. But for that to be possible, research needs to be open access, it needs to be available, and registering systematic review protocols and creating that accountability as well is a really great way of achieving that.
So say that registering means that because it's already there in the public domain, once you publish your review, someone can check, did you actually do what you said you'd do, or did you change your mind halfway through? And that goes back to what Jen mentioned about bias. So, you know, if you want to produce a biased review, you could be that, okay, you've done your protocol, but then you change your mind. Actually, I like that study, I like that person, I like the results they're showing, I want to include it, and I'll go back and change my eligibility criteria. But it's already in the public domain on a register. It means that you can't do that without someone questioning that.
Yes, thanks, Najma. Really important point there. So what does a systematic review protocol actually look like? It looks very similar to a published paper, and you will see that these sections that I've listed here, again, pretty much map onto these stages of the process and sort of the content of the webinars as we go forward. So we will talk next week a little bit about what you put in the background, because you're kind of setting the scene for your research question. You have your aims and objectives, which is pretty much your more closely defined research question and what you're actually hoping to do in your review. And then you spell out your methods. In great detail, you will talk about how you're searching, how you're selecting study, how you're extracting the data, how you're quality assessing your individual studies, your risk of bias assessment, and then also how you're synthesizing them. Are you meta-analyzing them, or are you doing a narrative synthesis? If you are doing a meta-analysis, what kind of statistics are you going to use, and that kind of thing. You would also include a dissemination plan. So how are you planning on sharing these results? Because another big problem with research is that it just sits somewhere and nobody ever knows about it, because either it's an unwieldy, really long piece of work that is impenetrable for the people who need to read it. Clinicians don't have a lot of time to read research. Policymakers often don't either. So this is where you really have a chance to make a difference. And these are all the things that we will cover in the webinars. And we will come back to this slide almost as a sort of checklist of the things that we have covered and what's still left to do. And I mentioned earlier, in a systematic review protocol, you would make a little bit of reference to who's on your team and what are their roles, and also what's your timetable. Because again, if somebody else finds your registered protocol online and they know, oh, they're planning on publishing this middle of next year, then people know that they can that when they can expect results, for example, if they need your findings to influence their practice. So a little bit more on registering. The sort of most obvious place to register systematic review protocols with a health-related outcome is Prospero. Prospero is hosted in CRD, where Rachel is based as well, and it's been phenomenally successful since it was launched. And the team are very, very busy registering protocols, but they need to have a health-related outcome. For anything else, there's one other free option that I have used before, which is OSF, the Open Science Framework. But there are also some paid options, such as Research Registry, who I think charge about £90 British per registration. And there's also the Joanna Briggs Institute that also registers systematic review protocols. In addition to registration, you can also publish in peer-reviewed journals, for example, BMC systematic reviews, which I think I've already mentioned, or in the Cochrane library, where there would be a so-called Cochrane protocol. So for each Cochrane review, there's usually also a Cochrane protocol that sort of comes first. And our overall aim for these webinars is to give you guys the skills and knowledge to produce a systematic review protocol to a publishable standard. So if you wanted, you could go and submit it for publication in systematic reviews, or if you're working on a Cochrane protocol, you might end up with a publication in the Cochrane library. So just a couple of points.
Jen, sorry, before you go further, there's been a question I think it'd be useful to pick up, which is, can we register protocol retrospectively?
Do you want to answer it?
Perhaps Rachel?
Yes, you can register protocols retrospectively, I think, and people very often do, but it's not ideal practice. In many respects, it's a good idea to get that information down before you start and make sure that becomes publicly available. And then if you do, for any legitimate reason, and there are legitimate reasons, and we will be talking about those, need to in some way amend your protocol later on, then it's best to do that and be transparent about the reasons why you've had to do that. So there must always be a rationale that justifies any changes to protocol. So people do put them down retrospectively, but you would have to ask what would be the purpose of doing that, I think.
Yes, great question. Thank you. And also thanks to Rachel for answering that so comprehensively. That's, yeah, really useful context there. And just a couple of points to keep in mind. If you're doing primary research, so if you're running trials or interviews or whatever, you are the one who's generating the data. In a systematic review, you are using data that already exists. Some of it might well be your own if you're also involved in trials, for example, or in other types of primary research, but you are using data that already exists, usually in the public domain. So often you will be aware of some of the existing literature before the review starts. Of course, that could bias your inclusion exclusion criteria for your review and sort of bias your outputs, but it's also a very important way of identifying gaps in the existing evidence, which often motivates new reviews, which is this point that we've already spoken about. So sometimes you have to just, you know, put your preconceived notions about the state of the literature aside and just have a look at what's out there when you embark on your systematic review journey. So there's time for questions now before I hand over to Rachel. So I'll just stop my screen share again for a moment, and just so that you can see the video is a bit bigger for any number of questions. Okay, do systematic reviews require ethics clearance or exemption? In my experience, if you're only using data that is already in the public domain, you don't need ethics clearance, because the assumption would be that all the primary studies that you're including have had ethics clearance as necessary. Is that right, Rachel? Is there anything else?
Yes, I mean, so a couple of things. I mean, sometimes you're actually not using research that's in the public domain as well. So, I mean, that's actually worth noting. But because it's secondary research and you're not dealing directly with individuals in terms of the summarization and analysis of the data, then you wouldn't require ethics approval. The possible exception would be, and this comes around thinking about the sorts of questions that you might be asking and the people that you might need to involve in order to ensure that you develop relevant questions, is if you do any kind of stakeholder engagement work, and some of that work might be research in itself, and in some cases there may be some ethical considerations that need to be taken into account as part of the process, because you're actually working potentially with patients or other individuals. But broadly speaking, they don't require ethics approval.
Yeah, okay, I'll just pick up one more question at this point, and then we will mop up all the other questions in the chat when we write it up and share it on the Google Drive. So the one that I was going to pick out here is, do some journals accept systematic reviews without protocol registered? I think most of the main journals don't anymore. Since the onset of Prospero and its rapid success, I think having a protocol registration and providing the registration number and the link to access that protocol has become part of the requirements for publishing protocols in any of the main international journals. I don't know of any exceptions off the top of my head.
Yeah, I think that's true. The main international journals, for sure, the mainstream ones, there are certainly journals that will publish systematic reviews without protocols, but I would be concerned potentially about some of those. I would also note, and this is quite important, that the sorts of funders that fund the sorts of research that we're interested in would always expect you to have a Prospero registration or some protocol registration if you were doing a systematic review. So for example, NIHR expects that.
Yeah, thanks, Rachel. So I will stop answering questions at this point now. Like I said, we will pick them up and put a document on the Google Drive to reply to them. So I'll start screen sharing again and hand the speaking part over to Rachel for a very, very brief introduction to Cochrane.
Thanks, Jen. I got the message. We won't be talking for very long. I'm guessing, judging by the experience that you all reported, that everybody will be quite familiar with Cochrane and with the Cochrane Library. So this is a really sort of quick spin through what Cochrane is and what it does. So you'll all know that we produce Cochrane reviews that are systematic reviews of healthcare and health policy. And they should be undertaken completely independently. They're done in a variety of different ways using a sort of global network of people, all members of the organisation called Cochrane, which is not for profit and actually a registered charity. Can we have the next slide, please? I can't do that, can I? Yes, thank you. So just in case any of you are unaware, Cochrane got its name from Archie Cochrane, who was a British epidemiologist a long time ago, who noted the level of what we now refer to as research waste, because of the number and proliferating number of articles, many of which came from high quality studies, including randomized controlled trials that weren't actually being taken into account either in the development of new research or in the treatment and management of people with health problems. So Cochrane has been organized in a very particular way. We have, as I say, we're a global network, and we have about 8 different networks that are very much healthcare focused. So in my network, for example, we host a number of different review groups who are working on mental health and neuroscience related reviews. And that network works together and in collaboration. But there are many other networks that have very, very different focuses. And we actually have about 52 different review groups. My review group is Common Mental Disorders, but there's another around schizophrenia, for example, in mental health, and 3 others that contribute to the mental health area. And I think it's important also to say that we really are very international. We have, I think, 43 countries, centres, Cochrane sort of groups of some description, usually centres based in 43 different countries of the world, all trying to promote and support the use of Cochrane evidence in healthcare policy and in clinical practice. And then I think finally, if we can just go on to the next slide, we have a number of methods groups. So one of the things that Cochrane has been incredibly involved in over the years has been developing the methodology for systematic review. So we've been going since 1993 now. That was when Cochrane was first registered. And since then, the number of contributing groups in different areas of healthcare and different areas of methodology have just grown and grown across the world. But the 17 different methods groups all contribute to the Cochrane Handbook of Systematic Reviews of Interventions, which you'll see there, as well as the Cochrane Handbook for Diagnostic Test Accuracy Reviews. And that most of that is actually available in book form, but actually the most up-to-date version is available on the internet. So it can actually be looked at if you want to, just online. And if we could have just the next slide. Thank you. I think, one of the things that we're particularly keen to note is that Cochrane actually has a number of different sort of products and services. So we produce the Cochrane Library, and in the Cochrane Library, we have the 2 things really that you can access. You'll see the Cochrane database of systematic reviews. That's where we publish all our protocols and all our reviews. And a defining feature of our reviews is that we strive, as appropriate, to try and keep those up to date. Sometimes they become redundant or irrelevant, but actually where they're important questions, we strive to keep those reviews up to date as far as we can. So that's the first distinguishing feature. The second thing is that we produce a large database of trials, which is called Central, and that's also housed in the Cochrane Library. So all of that is available to you, and it should be, I think, freely available to all of you at the moment. And then we have a number of different opportunities. So, for example, you will have seen we had Cochrane Interactive Learning as part of our offering for this particular course. So that's another area where Cochrane's been very much contributing to building capacity in this area. And we produce software. So some of you will be familiar with RevMan, for example, or Covidence, which are used routinely both inside and outside of Cochrane to produce systematic reviews. So I think that's just a sort of very brief run through, other than to say, if we could just go on to the next slide, please. A very distinguishing feature and of relevance to this group is that all Cochrane reviews have what we call plain language summaries, and these are translated and made available to everybody in every country, even if they don't have access to the Cochrane Library. So it means that the reach of a Cochrane review can be enormous, and particularly with kind of regional representation, I think that's very important for the impact project and the sorts of things that we might want to achieve here. So I just wanted to sort of flag that to you and alert everybody that it's worth going and having a look at some of those plain language summaries, and they will have been translated into a number of different languages, which may be relevant to you as well. I think that's probably enough for now, other than to say members of my team in Cochrane Common Mental Disorders may well be helping. You'll have seen some of them listed in the materials that you received during the course of this webinar series. So you will probably get to meet other members of the team who have particular specialist skills and knowledge in certain areas. So thanks for listening. Over to you, Jen.
Thank you, Rachel. That was really useful for the sort of wider context. And I think, like I said, we can't really talk about systematic reviews without talking about Cochrane. And the timing is working out beautifully. I'm really very happy about that, because we've got about 3 minutes left. And I'm sure there are questions still coming in on the chat. But like I said, we will put those either in a document on the Google Drive, or the ones that we don't address specifically, we will, and that will be because they get covered in the next sessions anyway. So we don't want to, repeat ourselves or jump ahead. So if there's things that will get picked up anyway, we might not pick up the questions specifically. So just a quick slide about the homework. We've talked a lot about protocols today in a sort of theoretical way. So what we would like you to do is just to go and have a look and find some. We will also put a couple on the Google Drive for you to have a look at. But I think if you actually go into the Cochrane Library, have a browse of BMC systematic reviews, many of those are open access, so you should be able to access the full texts. And also have a look around on Prospero. You can search Prospero using a search sort of function, or you can just browse. And if you're picking up anything that strikes you as particularly interesting, or something that notice that they have in common, or maybe where Prospero registrations are different from the published ones, just make a note of these things, and we will follow up on that at the beginning of the next session. So in terms of what happens next, in a couple of days' time, we will upload the slides as well as a summary of the chat and questions on the Google Drive. We will capture the unanswered questions and either answer them or build them into the next sessions. We will also add the homework, and we will also email you this, so there is no way you can miss it. And then we will start the next session with that discussion. And we will also send you an evaluation form. So please, please, please take the couple of minutes, it's very short, to complete this, just so that we get your feedback and can make the sessions to as good as we can to make sure that you get out of them what you need, and that they are properly useful for you. And of course, we will share the Zoom details and the schedule for the next session sometime during the next week, probably. It is the same link as you used this time, but we will share it again just to make sure everybody's got it. So on the stroke of 11 o'clock in the UK here, I've arrived at my final slide. And I would really like to just say thank you so much for joining today. What are the numbers now? 83 participants, which is fantastic. And thank you for being so active on the chat and really contributing to a really, really useful discussion. And I hope it was useful for you guys as well. And I hope to see many of you again next time. The next session is 2 weeks.
Jen, you're frozen now, but just to say that I think people are concerned that the next session might clash with Eid, but we'll have a think about that. But they are recorded anyway, so.
And yeah, I think just there's been quite sort of stuff coming up in the chat, so we will make sure that we cover off all of those in the stuff we provide.
Okay, thank you very much, everyone.